The muscles of the leg are all ensheathed with crural fascia, which is a form of deep fascia which is continuous with the fascia lata proximally. This fascia attaches directly to the surface of the anterior tibia and its medial borders, and it becomes continuous with the periosteum. Because it serves as an important attachment site for muscles, it will be thickened superiorly and anteriorly. And if we have a look a little further down here, we can see that it's also thickened and gives rise to these retinacula, which are extensor retinacula. It has several functions. Among these are to help the functions of the venous pump by limiting the expansion that is possible of the muscle bellies when they contract, and it also has important functions to help compartmentalize the leg. The two bones are the tibia, which is the one that is weight-bearing, and the fibula, laterally, which is not weight-bearing, but it serves as an attachment site for muscles. The tibia articulates superiorly with the femoral condyles. Inferiorly, it articulates here with the talus of the foot, and laterally, both inferiorly and superiorly, with the fibula. Moving on to examine the lateral compartment of the leg, we will see that we have two main muscles in here, which are going to be the fibularis longus and the fibularis brevis. Both of these muscles act as everters of the foot and as plantar flexors. The nerve of this compartment is the superficial fibular nerve. After appearing for the first time at approximately mid-level of the leg, the superficial fibular nerve will continue onto the dorsum of the foot as the main sensory nerve, where it will give off several superficial branches. If we follow the tendons of the fibularis longus and brevis distally, we can see that both of these tendons will be passing deep to the superior and inferior fibular retinacula. Also, you will see that the tendon of the fibularis brevis is anterior to the tendon of the fibularis longus. Interestingly, the fibularis brevis tendon attaches right here, which is on the tuberosity of the fifth metatarsal bone, but the tendon of the fibularis longus has a much longer course. It actually enters the sole of the foot, and in the sole of the foot, it's going to attach to the plantar surface of the medial cuneiform bone and the first metatarsal. Now moving on to the anterior compartment of the leg, which is the one that contains all of the muscles that are dorsiflexors of the ankle joint and also extensors of the toes. For this, I'm going to switch back on the nerves and the arteries. The nerve of this compartment is the deep fibular nerve. Our most medial and most superficial muscle is the tibialis anterior. This is a strong dorsiflexor of the ankle and an inverter of the foot. Next in line are extensor hallucis longus, which is the extensor of the big toe. You can see that most of this muscle is covered from this view because lying over it is the extensor digitorum longus, or EDL, which in turn extends the other toes. And in addition, we have one more muscle which is not going to be present in everybody, which is called the fibularis tertius, and it is located right here. And as you can see, what it does is that it contributes to the fifth tendon of the extensor digitorum longus. If we briefly review some of the items that we've just encountered in the anterior compartment of the leg, we will find the following. We'll find the tibialis anterior tendon. We'll find the extensor hallucis longus tendon. We will actually find the dorsalis pedis artery, which actually starts off as the anterior tibial artery. We will find the extensor digitorum longus, and, if present, the fibularis tertius. And last but not least, the nerve of the anterior compartment of the leg, the deep fibular nerve. To show more of this, we're going to have to remove some more of the muscle. And sure enough, here's the deep fibular nerve, and we can see that it has a common origin right up here as the common fibular nerve. And on a side note, the common fibular nerve is actually the most frequently injured nerve in the body because of its superficial position right here in close proximity to the head of the fibula. We can see that the common fibular nerve then splits, and we have two branches. We have one which ends up being the superficial fibular nerve. We can see it here, and we've seen it earlier. And then we have the deep fibular nerve, which courses together with the anterior tibial artery directly underneath the knee. It starts. Here's the deep fibular nerve, and here's the anterior tibial artery. Let's return to the ankle region now and appreciate that the anterior tibial artery changes its name into the dorsalis pedis artery as it crosses into the dorsum of the foot. Please be aware that in lab, actually, most of the structures that we're going to be interested in are going to be covered by these extensor retinacula. But here, with the ease of a single mouse click, we can get rid of all of it. In addition, we have some more muscles, which would be the extensor hallucis brevis and the extensor digitorum brevis. And interestingly here, they actually share a common muscle belly that attaches to the calcaneus. In the dorsum of the foot, we should also be able to identify a couple of additional arteries that are coming off of the dorsalis pedis artery. We would have, for instance, our lateral tarsal artery and our medial tarsal artery, or arteries, in addition to our arcuate artery. You can recognize the arcuate artery because it's a branch of the dorsalis pedis that spans across the proximal ends of the metatarsal bones, as you can see here. If I briefly hide all of the arteries and show us only the nerves, we should be able to appreciate that the deep fibular nerve actually also has as the territory that it supplies the first little web space here, right in between the big toe and the second toe.